Hi and welcome back. Today's topic is brain injuries. All brain injuries are unique, and the brain can receive several different types of injuries depending on the type of force and amount of force that impacts the head. And the type of injury the brain receives may affect just one functional area of the brain, a few areas, or all parts of the brain. So, an acquired brain injury is an injury to the brain that is not hereditary, congenital, degenerative, or induced by birth trauma. So, in other words, it occurs after birth. The injury results in a change to the brain's neuronal activity, which affects the abilities of the nerve cells in the brain. And there are two types of acquired brain injury: traumatic and non traumatic. A traumatic brain injury is defined as an alteration in brain function caused by an external force. Traumatic impact injuries can be defined as closing, which is non penetrating, or open, which is penetrating. And any injury you receive to your head that does not go through the skull is a closed head injury, whilst an open head injury results when the scalp is broken, fractured, or penetrated. And these typically arise from falls, assaults, motor vehicle accidents, and sports injuries. Traumatic brain injuries can have wide ranging physiological and physical effects. Some signs or symptoms may appear immediately after the traumatic event, while others may appear days or weeks later. The physical signs and symptoms of mild traumatic brain injury may include loss of consciousness, headaches, vomiting, fatigue, speech problems, or sleeping difficulties, and cognitive symptoms include memory problems, mood swings, or anxiousness. For more severe traumatic brain injuries, further physical symptoms include seizures, dilation of pupils, numbness in fingers and toes, and a loss of coordination. And further cognitive symptoms are slurred speech, agitation, and possibly a coma. A non traumatic brain injury causes damage to the brain by internal factors such as a lack of oxygen, exposure to toxins, or pressure from a tumor. And examples of this include a stroke, aneurysm, tumor, infectious diseases that affect the brain, such as meningitis, or a lack of oxygen supply to the brain, such as a heart attack. I will now go into detail about what happens during a stroke and later an aneurysm. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients, and brain cells begin to die in minutes. Signs include difficulty speaking and understanding what others are saying, paralysis or numbness of the face, arm, or leg, problems seeing in one or both eyes, headaches, sometimes including vomiting, dizziness, or altered consciousness, and trouble walking. And there are two main types of stroke: one caused by a blocked artery known as an ischemic stroke, or the other leaking or bursting of a blood vessel known as a hemorrhagic stroke. A stroke can sometimes cause temporary or permanent disabilities depending on how long the brain lacks blood flow and which part was affected, and complications that arise from it may include paralysis or loss of muscle movement, difficulty talking or swallowing, memory loss or thinking difficulties, emotional problems, pain in the parts of the body affected by stroke, and changes in behavior and self-care ability. An aneurysm, on the other hand, refers to a weakening of an artery wall that creates a bulge of the artery. Most aneurysms do not show symptoms and are not dangerous, yet some can rupture, leading to life-threatening internal bleeding. Aneurysms of the arteries that supply the brain with blood are known as intracranial aneurysms. Due to their appearance, they are also known as berry aneurysms. A ruptured aneurysm of the brain can be fatal within 24 hours, and 40% of the brain's aneurysms are fatal, and around 60% of those who survive will experience a resulting neurological impairment or disability. And if it bursts, it can lead to a hemorrhagic stroke, hydrocephalus, which is water in the brain, a coma, vasospasm, known as a constriction of a blood vessel, or long or short-term brain damage. And vasospasm is the main cause of disability or death following a burst aneurysm. I hope you found this video insightful and come back next week to hear about some of the deadliest infections.